in part because they get quality primary care to the mothers before they show up at the doorstep, 8 months pregnant. And it's simple public health things that we sort of know, but we're not set up in organizations that are concerned about that broader notion of health. So high performance is going to have to change the nature of the delivery organization in some way.
Nor are we incented to do that anyway. I mean, we're incented, we're
exactly.
Episodic care, fixing broken things, not preventing things from getting broken, so.
Yeah, but that's starting to change. I think that's one of the things that we're seeing is that we're now being able to recognize that, if I reward you for doing different things, you will behave differently.
But it seems like the new legislation, the new structures, are driving us towards mobile health. I mean, I'm saying the obvious here. I was at a medical device connectivity conference last September with my favorite partners, Dr. Julian Goldman, I'm sure you know, anesthesiologist, runs the medical device plug-and-play program in the country. And he made the statement, in 2012, we'll be crowdsourcing clinical apps. Think about that one for a moment. And we heard Naomi Freed from Boston's Children down the street. They're talking about all the clinical mobile apps being developed in that inpatient, teaching hospital inpatient setting. I guess maybe it's teaching. But I mean, so lots happening in Boston apparently, but I think it's happening, and it's happening in Oakland and LA and some other places as well. No, we all know the laundry list of what's possible with clinical mobile apps. I mean, education and awareness, remote data collection, remote monitoring. Anyway, we're going to be continuously monitoring folks wherever they are. I mean, I'm saying things we all know.
I know Todd Park, I heard him speak about, must have been about 6-7 months ago down in Florida. He talked about they have codathons. Everybody here know what a codathon is? So, okay. For those who don't, it's essentially you bring a bunch of really smart people together who are really good at coding, writing software, and they give them some subject, and they all go at it, and they compete to put together an app. Is that probably a good way to do that, say that? So that's probably going to move along in terms. But let's get back to the IT piece. So we're going to have changes in our various systems. But what is the role of IT? What are the things that you see IT doing with these changing systems and these high-performance systems? What's their role? What are they going to deliver?
I can share, one of the biggest gaps that we're concerned about when we look at where we are. And you're even seeing it in a number of high-performing organizations. We really need access to information by all members of the care team and exchange of information between primary care physicians and specialists and hospitals and doctors after discharge, but we really don't have much in the way of electronic health information exchange in our country, and don't have yet consensus on a strategy on our path forward, and that's of great concern to us. We won't get to coordinated, accountable, patient-centered care unless we solve that problem. So I think the next, and Kaiser, has worked with it internally, and I know there are some coalitions and collaborations out there that are moving this forward, but that, I think, is one of the biggest challenges that we have. We're at a critical point right now in the next couple of years. We've got to solve that problem. And I think, Barry, as you mentioned, aligning of incentives will help us quite a bit. I think the question is how much will the meaningful use incentives play a role? So, big gap area.
Yeah, I'll add to that. Having worked now on both sides of this equation, what's interesting to me is that before we get to exchange of information, which I totally agree with her, is kind of the foundational thing that leapfrogs us much further. What I've found working with customers is that there's a data normalization and data governance problem that we still have. There's a definition problem as to what is an admission or what is diabetes. I mean, my former employer had 7 different definitions for what an admission is. Now, Partners Healthcare has got 2 of the best hospitals in the country working for them. There's a lot of egos that go along with that. And they couldn't even figure out kind of what that definition is. And so where IT becomes a problem is when you have different definitions for stuff, because they have to code it. They have to get down to the exact process. And so I think IT will be the enabler that actually forces tough conversations. And so that may start with normalization, that may start with governance issues, it may start with workflow issues, what have you. But they're the ones that are going to have to force this conversation to move to the next step. I think standard boards like IHE are trying to help that integrated healthcare enterprise and stuff like that. But we still have a fundamental problem at Partners and as well as many other organizations. We had 1,000 applications in our environment. 1,000 applications, 1,200 servers. And so you just think about the data storage that goes on and spread around, or the interoperability that has to occur to make sure that the doctor gets not only the information, but the right information, which is two different things. They can get a slew of information about a patient, but can they get the right information at the right time will start to be the equation that it gets played out, and IT has to enable that. And so IT's got a huge job over the next 5-6 years in healthcare to do a lot of these things, to normalize things, to make it work.
You know, maybe an anecdote, I think that's a really good point, but and I hate anecdotes because it's hard to generalize, but I've got a 95-year-old mother who's living in assisted living right now. Regularly will get, I hope you don't mind me talking about this, but she gets a UTI, which causes her to stop drinking, and she gets dehydrated, and then she gets weak and starts to shake. And at that point, the nurse in the assisted living says, oh, something's wrong. They call the doctor, they bring an ambulance, they ship her to a hospital, they put her on an IV, she sits in the hospital bed for 2 or 3 days and gets weak and gets disoriented, and then comes back and has to have rehab to get back to where she can care for herself. Well, the role of IT, I mean, why did they bring this woman, this 95-year-old woman, to the hospital? Well, the physician's concerned that she won't get the, get a proper IV, the fluids back in the system, won't get treated with the antibiotics for the UTI, and there will be nobody really to watch her, to monitor her physiological progress. So the role of IT, again, getting back to my point of it's trying to find a goal of increasing the quality of care. She's better off staying where she is if she could be monitored and everybody would be comfortable with the information that they're receiving about that patient. So there you've improved quality, you've decreased costs because you haven't shipped her, you haven't used the ambulance, you haven't shipped her to the ER, you haven't admitted her to the hospital, and you haven't put her in rehab. So, that's sort of the getting back to the practical, what does it do for us as a system? Some of the I think you had the telehealth things that you talked about here yesterday, I believe. There's all these what do they call it, bendable technologies, these chips that are now like rubber bands that you can put on the body and they'll monitor physiological symptoms and report that. If the physician's comfortable with the information they're receiving and knows that they will get a warning should her hydration levels or oxygen levels change beyond some normal, and then can call and get intervention. That's the role of IT, and it's integrated into that clinical side. Long story, sorry.
In the Consumer Electronics Show this past January in Las Vegas, the hottest thing they talked about was not 3D TVs, it was sensors. Mm-hmm. And what was interesting is in the computer magazines, not written for the geeks, but written for folks like us, unless of course you consider yourself a geek, they talked about sensors and healthcare. PC Magazine had the editorial where they talk about what's in the issue and CES, and they talked about sensors and healthcare. So I think there's this revolution, this wave that us in healthcare, IT, we're so focused in on meaningful use and EMRs and stuff. All these other people out there are going to cover us with this tidal wave of information and IT stuff through sensors. So,
of course, I see the thread between those. That as we move to care outside of the normal locations, These sensors will just feed the data back. It all works together somehow with these
Yeah.
open collapse.
But the real challenge, though,
Yes.
is if you have all of these sensors and information, how do you process them? How do you do? What do you do with them? And if you think about the model, it's a little bit like the physician who says, oh, I'm going to allow my patients to email me. Then how does that physician get reimbursed for their time because they're doing the email? The same thing, if you have so many sensors, who's going to monitor the sensors and who's going to pay for the person who's monitoring it? So that's a different, maybe that's a discussion for another day, I'm not sure, but if you have a comment, feel free.
Well, that comes,
Yeah.
I think we all do, actually. I mean, that comes back into, my field. We're trying to stay ahead of the curve and train people to meet this new world that we don't fully understand yet. And exactly, who's going to be the person charged with collecting and monitoring and reporting that information? I mean, you don't want your most expensive resource, your physician. I mean, that's not a very efficient use of time, I don't think. So we probably are envisioning some new kind of tech worker, information management worker that can fill that role. I mean, I don't think that's fully been fleshed out, and it depends on how the technology unfolds, how the incentives push us, but I can see people with different sets of skills, combination of clinical skills, because they're going to have to understand the underlying clinical processes that are going on, but also much greater technical skills to be able to just stay on top of all this flow of information. I mean, we're all getting inundated with emails right now. We get stuff that's being shot at us all the time. And how are we managing that in our personal lives? Well, think about this from a clinical perspective. All of a sudden, you've got all these remote monitors for elderly sick and healthy people and people having heart attacks in their office and all this, and it's just being flown at you. How do you parse that out? Not to mention what the liability is when that happens. If you had access to that information or should have had access to the information, you better respond to it appropriately. So.
Let me interrupt my fellow and tell you one very specific anecdote. Of course, many of you know that there was an FDA recall on a certain infusion pump, smart pump, and many organizations are replaced them. They're smart pumps under a time limit from FDA. My point being is the old smart pump had 50 drugs in the drug library. The new one has 2,500. It's changing the way practice happens. Then there's all the quality feedback of how's that working. So it's just one example of, we use technology to reduce the time nurses have to play with technology. But, we're moving to these settings where maybe that's not so simple.
Yeah, a couple of data points. IBM came out with a study that illustrated that a doctor can make a decision based on 5 attributes, 5 different distinct pieces of information, and that in 2020 there'll be 200,000 data elements associated with a patient. And so the sensors, all the different monitoring tools that will go on around a patient. And so I believe the game is not about EMR. The game is about analytics and serving up the right information at the right time. And that fundamentally there are, I saw another study that illustrated the #1 job in America in the next decade is around statisticians, is about mathematicians. And so this is what they're talking about, is that the ability to do algorithm analysis on a whole slew of data. Google's very, very successful because of their ability to do algorithms.